Imagine you wake up at 2 in the morning with excruciating stomach pain. Should you go to the ER, 24-hour urgent care, message your doctor and hope they respond in the morning? The average trip to the ER costs $2,600 without insurance and $412 with insurance. Painful, scary, anxiety-ridden situations like this one are universal in America today. But what if I told you there's one universe inside the multiverse where this nightmare doesn't exist? A universe where expert medical advice is a free phone call away 24 hours a day, 7 days a week for everyone. All right, let's start with a reality check. The US healthcare system is like a black hole, sucking trillions of dollars in, seemingly with no end in sight. In 2022, healthcare cost every man, woman, and child in the US the average of $13,500. To put that in perspective, that's like every single American buying a decent used car every single year. All of this spending isn't giving us the stellar results you might expect. US healthcare is so bad, it's not even great for the wealthy people and bad for everyone else. The data suggests that it's just bad for everyone. Now, you might be thinking, surely our politicians are all over this, right?
Don't call me Shirley.
Well, not exactly. Since Bernie Sanders exited the race in 2020, improving healthcare in the US has taken a back seat to other issues, leaving hundreds of millions of Americans sick, anxious, and paying out the nose for low-quality healthcare. But fear not, dear viewers, for in the vast multiverse of possibilities, there may exist a solution. And the best part is, it's already hiding in plain sight. A free nurse hotline is to healthcare what a 911 service is to public safety. Imagine there were no 911 number, and instead, each house was equipped with a panel with 3 buttons, a red button, an orange button, and a yellow button. Depending on how severe your emergency you were experiencing, you'd have to hit one of those buttons. You know a red button is for a really severe emergency, but what is a severe emergency? Lots of people might hit the red button in an orange situation and the orange button in a yellow situation, and so on. But this system would be crazy. You don't want a SWAT team to roll up and help get your sister's cat Ezekiel McFluffertons out of a tree. Back to our example of waking up in the middle of the night with excruciating stomach pain. You're unsure if you need medical attention, so you simply dial a number. Let's say 611. Within moments, you're connected to a trained nurse who can assess your situation, offer advice, and guide you to the appropriate level of care. And the cherry on top, it's completely free. Now I know what you're thinking, Professor Braus, this sounds too good to be true. How could we possibly make this happen? It might surprise you that the infrastructure for this revolutionary system is already actually in place. First of all, there are already many 11 numbers. 911, of course, is emergency services. 811, and this is true, is a national call before you dig number to prevent your Uncle Bob from electrocuting himself when he's digging to build his apocalypse bunker. 711 puts people with hearing or speech disability to use a telephone system via text. Since the year 2000, 511 provides travel information in the US and Canada, 411 is directory assistance, and 311 and 211 connect you to various city and regional information and services. I propose that this new nurse hotline be at 611 because historically 611 was for reporting issues for payphones and landlines. Also, some consider 611 to be an angel number, and seeing 611 repeatedly is a sign that a guardian angel is watching over and helping you. Okay, so we could call 611 for a nurse hotline, but what about the nurses? It turns out that they're already there too. If you do have insurance and an insurance card, take a moment and flip that card over. Every insurance card already has a number for 24/7 nurse hotline. These hotlines are already up and running. So all we need to do is make it so that these hotlines are accessible to everyone, regardless of their insurance status. Here's how it could work. A charitable foundation, the government, or even a consortium of health systems could compensate existing hotlines for out-of-network calls. By creating a universal number, like our hypothetical 611, we could provide this service to everyone, everywhere. And, predictably, the consequences of a free nurse hotline on healthcare and health costs would be large. First and foremost, we're looking at improved health outcomes. An ounce of prevention is worth a pound of cure. By providing easy access to professional medical advice, people are more likely to address health concerns early, preventing minor issues from escalating into major problems. Secondly, imagine the reduction in anxiety for those without easy access to healthcare. No more sleepless nights wondering if that persistent cough or cluster headache is something deadly. This peace of mind alone could have profound effects on mental health and overall well-being in the United States, so people would be healthier and less anxious. But this system also could save an enormous amount of time for both patients and healthcare providers. Think about it. How many ER visits could have been handled by urgent care? How many urgent care visits could have been simple doctor's appointments? And how many doctor's appointments could have been resolved with a 10-minute phone call with a registered nurse? If the free nurse hotline could guide people to the appropriate level of care, it could not just save time, it would save a tremendous amount of money. Lots of money. Correctly triaging the severity of just traumatic injury could save the country an estimated $12 billion in 2008 dollars. That's not even counting the better triage of other sorts of disease and illness, which would save many more billions. So, how do we turn this multiverse solution into our reality? Well, there are a few potential routes we could take. Federal, state, or even city governments could pass a law to organize and fund such a system. They could negotiate with health systems to pay for out-of-network calls to their nurse hotlines. A group of forward-thinking health systems themselves and insurers could join forces to create this hotline. Their motivation? The potential to attract new patients and customers. A charitable foundation could kick things off by starting a hotline for a specific region or population. Imagine a free nurse hotline for young mothers and children in a major city. Now, I wouldn't be a proper interdimensional professor if I didn't address some of the potential hurdles we might face. First off, let's be real. Setting up and running a system like this at a national scale would be incredibly complex. We're talking about coordinating multiple health systems, managing massive call volumes, and ensuring consistent quality of care. It's like trying to conduct a million-piece orchestra, challenging but not impossible with the right leadership and technology. Secondly, while a free nurse hotline would be a huge step forward, it's not a complete solution for our healthcare woes. People would still need health insurance to access treatment beyond the phone call. Some sort of universal public option insurance is still a requirement to really solve healthcare in the United States. This brings us to a crucial point. As we face potential job loss due to AI and automation, it's more important than ever that we decouple health insurance from employment. A universal free nurse hotline could be the first step towards the comprehensive universal health insurance system that the United States so desperately needs. So, there you have it, fellow multiverse explorers. A simple yet powerful idea that could transform healthcare as we know it. A free national nurse hotline isn't just a pipe dream, it's a real solution hiding in plain sight. Let's turn this solution into our universe's reality. Remember, every great change starts with a single step, or in this case, a single phone call. Until next time, this is Professor Braus reminding you that the solutions to our problems are out there in the multiverse.